I get to introduce my student. So Elizabeth Brueggemann, like Bailey, is an undergraduate at Spring Arbor University, like Bailey's institution, we're a small Christian university. And like Bailey, Elizabeth is also a student athlete. She's not a bowler. Elizabeth runs track, and she's a sprinter and a jumper, and I think you throw things too, don't you?
Yeah, I do.
Yeah, she throws a javelin. She throws her teammates. And Elizabeth is somebody who has been very eager to do research, and she's done research with Dr. Ziegler here. He's a physical therapist who works at SAU, and this has been a great journey for her, so without further ado, I'll let her introduce her topic to you.
All right. Thank you, Dr. Bradovich. Like he said, my name is Elizabeth Brueggemann. I'm a senior at Spring Arbor University. Just so you know, I have my computer up here because last night I tried to print off my notes, but I was one of the million people without electricity, so I'm just going to have the laptop up here. So my research that I'm going to present to you today is about the efficiency of ASTYM, which is a mobility treatment, and the use of diagnostic ultrasound in order to evaluate the health changes within various shoulder injuries. So, by the way, I just want to say that even though ASTYM is a company, there is no conflict of interest during this research. So the purpose of this slide is we wanted to evaluate volume, area of blood flow, vasculature, and overall health changes of the supraspinatus tendon and bicep long head tendon with each case study treated with ASTYM using diagnostic ultrasound over time. There's a lot of words. I'm going to explain those in a few minutes, but this is just our purpose. So volume, area, blood flow, vasculature, overall health. So ASTYM stands for Augmented Soft Tissue Mobilization, and it's a soft tissue treatment technique usually used in physical therapy clinics. What it does, it removes scar tissue within muscles, and it also repairs tissue and tendons in the surrounding area as well. So on the right is a simple video demonstration of what ASTYM is. I just wanted to give the audience an idea of what it actually looks like, but this is very simplified. There's also, according to ASTYM's website, it increases fibronectin. Fibronectin is a glycoprotein that is important and plays a major role in healing, and it's associated with multiple pathologies throughout the body, including fibrosis, cell adhesion, and cell growth. And it also increases collagen as well. But I'll talk more about the cellular level on another slide. But for right now, we are looking at more of the clinical applications in which that was my study. So what we used in order for the diagnostic ultrasound was we used musculoskeletal ultrasound, also known as MSK ultrasound. And the picture on the left is a picture of bicep long head tendon on the patient. It's on a short axis, as you can see, it's horizontal. And on the left side on the right side is the supraspinatus tendon using the MSK ultrasound, and this has a long axis, and you can see that it has a more vertical with the module that is used by the physical therapist. So what MSK uses, it uses sound waves in order to view soft images throughout the body. And so what we did for our technique for when we were making the research happen, we took 10-second videos of both the bicep long head and the supraspinatus tendon long head, supraspinatus tendon, and we took 10 seconds before the treatment. We would complete the treatment, and then we would take 10-second videos afterwards. This research went on for about 6 weeks. The patients would come twice a week, and yes, that's it. So after the first treatment, we noticed increased blood supply, but that can happen with any massage therapy. But after this case study was done, we noticed no significant change within the tendon blood supply. 3 out of the 4 had slight increased thickness of the bicep long head tendon, and 2 out of the 4 of the case studies that we did increased thickness of the supraspinatus tendon. So not all of the case studies had thickness change, but that could be due to age or injury. But longevity of the treatment could change these results as it goes on. But what we are going to review is is only one case study, and in particular, the supraspinatus tendon. So before we actually look at the MSK ultrasound, I just want to review the anatomy of the shoulder with everybody. It's been a while since I took anatomy. So here's the supraspinatus tendon up at the top, and that's the bicep tendon. It's at the lower end. The transducer would be placed along this way for a short axis shot. For a long axis shot, the transducer would be in a more vertical position. So in order to view a clear, consistent shot, we had to use a particular bone landmark. Note that this module doesn't have the subscapularis muscle. That's because we removed it in order for you to see. But the shot is going to be, we use the rear tubercle of the humerus, and the supraspinatus is up there, of course, and so it's going to be so this was our landmark in order to see what we were trying to view when we used the MSK ultrasound. So this is what the shot is going to look like. Oops. Yeah. There we go. And so this was the actual shots that we took. So each of these are about 10 seconds each. On the right side, the video on the left is the supraspinatus before any ASTYM treatment had occurred, and the video on the right is after the 6 weeks and the post-ASTYM treatment. So there are a couple major differences within these two. As you can see on the right, it's a little brighter compared to the left, and that means it's hyperechoic. This just means that this indicates that the muscle is thicker. Also, looking at the tendon, well, let me just tell you what everything is at first. On the very top is the skin. Underneath the skin is subcutaneous tissue, and then underneath that, around here, is the deltoid muscle, and then the actual tendon is this area, and then the greater tubercle is this mountain-looking peak. So, like I was saying, the tendon on the right looks a little brighter, so that's hyperechoic, so much indicates it's thicker. And also, you can just see that the density within the thickness compared to this one is, there's just more density and more thickness, so this kind of suggests that there's more collagen growth within, after the ASTYM treatment. So how come these changes are happening within these patients, and when ASTYM is applied? So So what we believe going on, based on conversations that we had with ASTYM representatives, just to understand what we thought they thought was going on the cellular level, is that growth factors from unidentified cells cause the healing. These cells could be from fat pads or platelets, but what growth factors and where they come from is currently unknown. But this is a schematic of the tendon. So from left to right, we start with the collagen proteins. They cross-link together in order to make the fibril subunit. Then the fibril subunits make the collagen fibril. The collagen fibril make the collagen fiber. You can follow across on the very top. And then the collagen fiber makes a fascicle, and the fascicles make the whole tendon. And this is all done in a radial configuration. And Notice that there are tenocytes within and around the tendon, which are these little things over here. Those are fibroblasts, and fibroblasts need growth factors in order to make collagen, because growth factors wake them up from quiescence. Well, also note that, like I said earlier, that ASTYM said that it increased fibronectin. Well, fibronectin is necessary for the fibroblast deposition for collagen composition, which is what exactly was suggested within our video. So in order for future studies, clinically, we would like to study more morphological changes that take place within the tendon. Is there a trend of the tendon to be more likely hyperechoic or hypoechoic? Are there any physical changes that happen within the tendon? Does the tendon always enlarge? Also, from all our subjects of the case study, we only had positive reviews of ASTYM. We would like to continue these positive reviews and see these positive results also in patients. But overall, we want to see longevity of the research. We want to know how the patients proceed as the treatments continue, because we only did do 6 weeks of treatment. So I would like to just acknowledge my advisors, in particular, Dr. Baratovich, who introduced me, and Dr. Ziegler, who was the physical therapist, who helped me a lot throughout this project. I'd also like to thank Dr. Sieber and Dr. Kivlin, who were the ASTYM representatives, and they were very helpful within the conference call that we had. And then I'd also like to thank Spring Arbor University for the Natural Science Department and the Physical Therapy Clinic in order for me to do my research, all the case study participants, and all of you who stayed to see this presentation after this long day. And thank you. So any questions or remarks? Yeah.
Do you think this is something that's going to end up in like all colleges or some version of it?